promising preliminary results suggest that an investigational molecule may help reduce the occurrence of cardiovascular events by removing cholesterol from atherosclerotic plaques. Dr. Ralph Brindis, past president of the American College of Cardiology, provided perspective on the findings.
This is a very exciting trial also being presented at the European meeting this week. The concept of being able to raise HDL levels in our patients, we think could potentially be cardioprotective. We certainly have good agents to lower LDL, which we know has definitely been shown advantageous in decreasing mortality and morbidity in patients with coronary artery disease. But we also appreciate we have a huge cadre of patients that have low HDLs, which have a special risk with coronary artery disease. And we're hoping that if we can find mechanisms to raise HDL levels, that may show improved clinical outcomes. The drugs we have to date, of course, have not been that effective. Niacin or fibrates or whatever have not been hugely effective in raising HDLs. So this trial put on by Genentech is quite exciting because here's a drug that has shown in other work and in this trial the ability to raise HDL levels substantially. Well, the clinical implications of this study are interesting. This is really, if you will, a first step because they did not look at clinical outcomes. You could argue that it's sort of a safety testing trial, a small number of patients, but it showed, as expected, the rise in HDL levels that related to Dalcetrapib that they were hoping to expect. And they showed that there was no substantial change with blood pressure with the medication. And then the interesting signal, or what you would call a surrogate endpoint of improvement of brachial blood flow, which is an indirect way of assessing endothelial function, which may be an early marker of the process of atherogenesis.
What are the next steps for this research?
Well, clearly the next steps, again, this is a positive trial, but what we have learned early on in medicine is that surrogate endpoints, which are very interesting, are not what we really need to know. We need to understand, does this drug really affect clinical outcomes? And that's going to be a long time study to be able to assess changes in development of atherosclerosis that will take years as opposed to a short study looking at, if you will, endothelial function determining by brachial blood flow. And we also need to have more long-term data about safety related to the drug. But this is an exciting new development in a new area that is certainly ripe for research and hopefully will have benefit for our patients long term.
For Global Medical News Network, I'm Heidi Spleet.